Hello everyone, I am Dr. Savitha, practicing in Bangalore since 20 years. I welcome you all to the online Repertory course 2021 guided by Dr. Kalathia. First of all, I would like to thank Kalathia sir for giving me this opportunity to share my learning. I have been a part of Kalathia sir's courses, almost all his courses. He is a wonderful teacher. His case exercise courses have helped me to refine my knowledge immensely. Today I am here to share a brief introduction on practical application of repertory with few case examples. I would like to start with the quote. Repertory is like a book of index of medicines under symptoms. It is related with Materiamedica, therapeutics and organon. Hence, Materiamedica and therapeutics are said to be the dictionary and organon as grammar by bogus EM. Repertory is the index of homeopathic materia medica, which is full of information collected from toxicology, drug proving and clinical experience. So, the success of usage of repertory depends on amalgamation of knowledge of materia medica, therapeutics and organon. Now let's see where we can use this repertory. Repertory can be used in acute prescribing, where there are very few symptoms and you need a quick prescription. Repertory comes handy. Repertory also helps us to enrich our case-taking skills. By repeated use of repertory, it helps us to guide as to how to take a case, what to expect in a case and what to ask, how to frame the questions. So that way your case-taking skills definitely improves. And repertory also helps in the studying of materia medica and memorizing them. Now after arriving at a repertorial totality and you have a certain set of drugs available after repertorization, and when you do a comparative study of those remedies, it always retains in your memory for a longer time. And repertorization also helps us to arrive at a simillimum expeditiously. That is, it is a quick and an efficient way of selecting a simillimum. And so selected simillimum is always definite, systemic and standardized way. And why there is a need for standardization of any selection of remedy? Because standardization not only helps in the present prescription, it also helps for the follow-up and to decide on the posology. Repertory can also be used as a reference book. Now there are certain limitations for the usage of repertories. The use of repertory cannot be independent of knowledge of materia medica, organon and clinical subjects. Remedy obtained from repertorization cannot be taken as a final prescription. Now you repertorize a case and you arrive at a remedy and you cannot directly prescribe those remedy without cross-referring it from materia medica. Success of repertorization depends on physician's skill. If the rubric selected by the physician is not proper, then the whole case can be an utter failure. So it purely depends on the physician's skill. You have to really be very accurate in selecting the rubric, exact rubric, arriving at PQRS, observation. Everything is important to select the rubric. Otherwise, the case can be an utter failure. Now, I would like to give you a few case examples. This is case 1. It is patient aged about 22 years, female. She came to me with acute suppurative otitis media. She complained of severe pain in both the ears, blocked feeling. She had a blocked feeling. She had not kept cotton in her ears, but it was like as if she has kept cotton. The blocked sensation was like that. And pain increases in open air. There is offensive discharge from the ears. Pain is twitching. And sweat is very offensive, itchy and excessive. Clothes get worn out, more on the foot, even the footwear gets worn out. So this sweat was so severe for her, so excessive that even her clothes used to get torn. And here this sweat has been there through and through. She is coming for other chronic problems also, but this sweat was there all through and through in her case. But here I chose to take it as a concomitant because during any attacks, any acute attacks like maybe migraine or pain in the ears or dysmenorrhea, whatever the acute phase, whenever she had any kind of pain in her body, she would have this sweating used to be more during that time. So I chose to take that as a concomitant. Now, rubrics selected were ears twitching. Now I chose Bonninghausen because it is a complete symptom. There is location, sensation, modality and concomitant, and usually I use Bonninghausen's repertory or Patak repertory in acute prescriptions, and especially if it's a grand totality and if it's a grand symptom and a complete symptom, I usually choose Bonninghausen characteristic repertory, which has helped me a lot in acute prescriptions. Now here rubrics selected were ears twitching, discharge offensive, stuffed feeling in the nose with wool as if, in ears with wool as if, and aggravation amelioration, air open in aggravation, sweat excoriating, erosive. Now the remedy which came up was Silesia. Now when I cross-checked with Boger's synoptic key, I got this symptom: foot, sweat, foul, itching, acrid, destroying the shoe. Now this particular symptom I could find only in Boger's synoptic key, where it was exactly the same what the patient was suffering from. Now we know that this is it's a very simple case. Now even without repertorization, anybody could have easily prescribed Silesia in this case, and definitely it would have helped. So now why there was a need for the repertorization in this case, or in any case, even if it's a simple case and it's a straightforward case, you know the remedy even without repertorization, then why do you want to actually repertorize such a case? Now here I had a very good learning from this case, because this patient had this kind of characteristic concomitant all through and through in her case. Now when she came for the ear pain also, it was more so like she was not bothered about her ear problem. It was most what is bothering was her sweat. She kept on telling that even when she came for the acute ear pain, she kept on telling that she explained more about the foot sweat. She told me that the foot sweat is so severe that she's very much worried about it, and she's very much distressed because she has to change her footwear every 2 months once, and she has this excessive sweating, especially in the acute phases like this. If the acute phase remains for about 2 to 3 days, the sweating is so much that the whole of her feet gets itchy, and even her footwear gets spoiled because of that. It gets torn because of that, and she has to change the footwear and other things, and it was bothering her too much. So I found this particular characteristic, this particular symptom to be very, very characteristic. Now she was coming to me for other problems like migraine and other things, and I had prescribed based on the totality at that time. I had prescribed different remedies like Natraview, Bryonia, but she was not helped that much. But when she came for this acute symptom, but actually when this was a first acute episode after she started seeing me, and when I took the acute totality, when I found this particular symptom, and when I cross-referred it in other Materiamedicas, I was double sure that I was double sure about the remedy Silesia. So I chose to give Silesia as her constitutional remedy, and after giving Silesia, even her migraine attacks, it's almost been a year, with just few doses of Silesia, she has not got a single attack of migraine in one complete year, and she had few warts on her neck which also fell off after 2 to 3 months. So here I want to make a note that sometimes acute state can be an exacerbation of chronic state. So that way it is important to repertorize and cross-refer the available symptoms in other Materiamedica. So my learning in this case was, however simple might be the case, however commonly prescribed remedy it might be, you have to always repertorize, cross-refer in different Materiamedica, and then only prescribe. And now in this whole case, actually this sweat itself, because I was very double sure, because I was in repertorization also I got Savitha, and when I cross-referred in the Materiamedica also, I got the exact symptom what she was suffering, because this particularly this destroying the shoe I did not find in any other Materiamedica. Look at the intensity of the sweat. It was that severe, and it is a grand characteristic which is present in her through and through. And this case actually, this sweat itself became an opening point for me to explore the whole case. Then later on, she, when I inquired about it, about her feeling about the sweat and other things, she told me that she was very much worried because her legs gets very dirty because always it is wet, and when she goes around always she has to wear a shoe, and if she wears shoe it smells a lot after some time, and if she wears a chappal her foot looks dirty, and she always had a feeling that what people will think about her, what opinion they will form on her, what will be her image in front of her, and the whole drug picture of Savitha came up when I tried to explore this. So this acute state was a kind of blessing for both me and for her, because it was able to resolve her chronic state, and this was possible only because I was double sure of the remedy, because I had cross-checked in both repertorization and in the source level Materiamedica book. So my suggestion here is, however simple might be the case, however commonly prescribed remedy it might be, you have to always repertorize and cross-refer with the available source Materiamedica books. Now case 2. This was a case of 12-year-old girl, case of chorea. Mother brought her for weakness of memory and absent-mindedness. Absent-mindedness was so severe that she would and also she had a lot of memory issues, and because of memory issues she was not able to study well, and academic performance had come down. She was not able to complete her classworks and homeworks and other things, and now and also whenever there was one particular symptom where whenever she was scolded or punished, she used to be punished both at school and home, because always her homeworks and classworks used to be incomplete, and teacher always used to complain that she never would complete her classworks, and always she would be punished. And one thing is, whenever she is punished or scolded, she would just stand still, and as if nothing, as if she is not knowing what is going on around her. Initially, parents thought that she was doing it purposely to avoid punishments, but later on they felt that she had really some problem, and they met a lot of neurologists also. And later all the tests were conducted, and everything came out to be normal, and chorea was diagnosed after that. And mother also told me that she gets these attacks whenever she is very much scared. And now there was one more symptom where I could observe when she came to my clinic also, like when I asked about her name. When she was about to tell her name, there was a lot of salivation from her mouth. She had to wipe that and then talk. And then the mother told me that this happens even when she is eating, like whether it's breakfast, lunch or whatever. Whenever she was about to eat something, she has this problem. Otherwise it will not be there, but night times there is drooling of saliva, all those things are there, but daytime there is no salivation. But when she is about to talk something or she is about to eat something, she suddenly gets a lot of salivation, and it has to be wiped, and only then she is able to go further. So that way she doesn't talk much also because of that. Now this was actually a very lengthy case, but here for the purpose of repertorization, I have selected only few rubrics, and I am showing you here. Now here rubrics selected where I chose nerve repertory. Here nerves, chorea, mental condition, fright from. Nerves, chorea, mental condition, frightened in girls who are punished. And inner mouth, saliva, profuse, tyalism, sudden attacks when she is about to move her tongue or as if chewing or talking. Mind and disposition, memory weak. Now, why did I choose nerve repertory here? I also initially did not know that I have to choose the nerve repertory. I'll tell you. Now here first the selected remedy was Ignatia. Now when I cross-checked in Herring's guiding symptoms, I chose to read Herring's guiding symptom because nerve repertory is based on Herring's guiding symptoms. So here Materiamedica goes like this: very great weakness of memory, forgets everything except dreams. Now this actually I also did not know that it will be there in Ignitia. When I read about these symptoms in Ignitia and when I cross-referred these things with the mother, this was there. Mother told me later that when she the memory is so weak that if you ask her to buy something from the shop, she would go, give the shopkeeper money and come back without taking the items. That was her weakness of memory. But she would recall certain dreams and she would tell. That she told me. I really did not know that this symptom exists in Materiamedica of Ignitia. But after reading this, I made a note of all these things and cross-referred with, I asked all those things to the mother and she confirmed me about all these things. And she sees everything as through a fog, sits quietly with a vacant gaze, always thinking about mortification endured and knowing nothing of what passes around him. So this was exactly what she was having. Patient also told me that she doesn't even know that she's going in through such an attack. Even after the attack also she won't know that she passed through that phase. It's only parents who can observe that she has that particular kind of a vacant gaze. Now this particular symptom really surprised me. Sudden attack of thyroidism without any apparent cause, aggravation from every motion of tongue as if talking and chewing. This was exactly what the patient was suffering. Now when I checked in other Materiamedicas, I got other rubrics like salivation excessive during, before attack, during attack, after attack in many repertories, but somehow I was not convinced. So what I chose to do is I really did not know that I have to check these things in repertory. When this case came to me, I just noted down what all points out of my observation and out of mother and tried to find out what is very characteristic. Now we know that any kind of epileptic cases or tics or chorea or any cases, there will be frothing, salivation are again common symptoms. But this particular symptom of suddenly getting excessive salivation, especially when she is talking or chewing, strike my mind. And when I checked in different repertories, I checked through Kent, I checked through Bore, Patak repertory, everywhere. But somehow, as I told you, excessive salivation before attack, during attack, after attack was given, somehow I felt that they were not matching my patient. It was not matching my observation also. So then I chose to pick up all the available repertories I have and I searched each and every rubric in all the repertories. And I found in nerve repertory, I could find the exact symptom what she is suffering. It was actually a surprise to me. And this was, and we know that Herring's guiding symptoms is based on exact prover's language. And this is what I found, and it was exactly matching my patient, and it's very characteristic. And later on, when I checked with other symptoms, everything matched with her. Otherwise, we usually think of ignitia in elderly women. We have read only about contradictory symptoms, grief ailments and things like that. The different aspect of ignitia altogether I could know when I read the Herring's guiding symptoms. Of course, other symptoms like absent-mindedness, difficult comprehension, mental dullness, mental effort is exam, because this was told again by the mother because of weakness of memory and other things. Always any other mental activity would give her irritation. So all the symptoms matched in this patient. So my learning in this case was like, you will never know, like even as I told you earlier, even I did not know that I have to check these things in nurse repertory. Only when I found that it was not matching my patient, I chose to find all the rubrics in different repertories. Now you don't have, my learning from this case was always whenever you get a case, it's not that you convert the rubrics and repertorize from all the repertories and then choose a totality. It's not like that. It's like you, whenever you get a case, note down according to your observation and what the patient is suffering. Everything you make a note, find out the peculiarity in that and try to cross check in all the repertories what you have, and then whichever rubric is best suiting your patient, you can select that rubric or that particular repertory in which that rubric is given, and definitely medicine selected in such manner is going to help your case very well. Now, with this, when she was given ignatia, and she improved a lot with ignatia. Actually, when she came, she was 12-year-old. Now she has finished her engineering. Her academics also improved very well, and that chorea attacks also went away. And she required, I think, probably 4 or 5 doses of ignatia. That's all through. And of course, she came with other acutes in between, which different remedies were given. But her main core problem of chorea and her weakness of still she has weakness of memory, but it has improved to a great extent. Like now she has developed interest in studies, and salivation is also there, but that amount of intensity of salivation is not there. Now she has almost in the engineering, she's doing her engineering, and she's doing very well in her academics also. So that way it helped my case. Now case 3. This case was of a female aged about 62 years. I had very less symptoms when I got this case. It was a case of CA stomach. Actually, the patient also was not in a condition to talk to me. So I got very few symptoms in this case. These were the only symptoms I could extract at that point of time, because patient also did not want to talk. There was poor appetite, heaviness in the abdomen. CA was diagnosed. Actually, 1 or 2 sittings of chemotherapy also was over, and he had vomiting few hours after eating, with sometimes occasional blood was there, and blood was after chemotherapy only. Before that it was not there. Burning in the chest was very severe. It was so severe that he said that as if there is some fire in my chest, and this kind of burning is more during vomiting. Otherwise, generally he doesn't have that vomiting, and this kind of a nausea and there is also severe pain in the abdomen, especially when he is fasting also. That is when he has not eaten anything. Like he is in a position where he can not eat anything, nor he can eat. It is like that, because if he doesn't eat and if he is fasting for a long time, there is a lot of nausea and there is severe pain in the abdomen. But if he goes to eat something, after eating, after few hours of eating, or sometimes immediately after eating also, he gets that severe kind of a vomiting bout where he feels that whole of his chest is burned. So he is so frustrated, so dejected that he cannot, there's a lot of pain, lot of nausea, he doesn't know what to do, he neither can eat nor stay hungry. He is in that phase, and whatever I tried to extract more, he was not in a position, because it was almost like from past 6 months he was suffering, and he was not able to eat much, because he had kind of developed fear for eating, because after eating he knew that after some time the whole thing would come up, and that time the burning used to be so severe that he could not tolerate. So, and in the fear of vomiting, if he doesn't eat anything, he would get pain. So he was in that state where I could not extract much of symptoms. So since this was a pathological case, I chose to take boric and Phatak repertory, and the rubrics selected were stomach cancer and boric, stomach vomiting, retching, remedies in general, causation cancer. The whole rubric is causation cancer in uterine and gastric and intestinal cancers. Then Phatak repertory, vomiting, acrid, scalding I took, and Phatak repertory, vomiting, cancer from, and again Phatak repertory, burning, fiery, because that was very prominent in this case. So now when I repertorize it, the first choice of repertory was creosotum. So I choose to read creosotum from Materia Medica. In Phatak repertory, it was given, Phatak Materia Medica, it was given that it affects the mucous membranes of the digestive tract, female genitals, deorganizes the blood, excoriation, burning like fire, profuse, acrid, hot, foul discharges like irritations or sputum. Now this can be used in cancerous affections, and it is suitable to lean persons, in especially old women. Then I read in another book, Otto Lesser's textbook of inorganic substances by Otto Lesser. It's given nausea, retching and vomiting of undigested food several hours after eating, and it also helps in ulcerative process of bloody vomit, particularly of a malignant nature, can be at least improved by creosote. The gastric pains are severe, burning and constrictive, but a nagging fasting pain in the morning with vomiting is also observed, and this diminishes after eating. So this was again what the patient was suffering. Here I had only few symptoms, but in that few symptoms only, if you select the characteristic symptom. Now in this case, especially burning, if I had just taken burning, I would have got other remedies like sulfur and other things. Or if I had not repertorized and just given according to my general knowledge, I would have chose arsenic, phosphorus or some acid group or murk and so on. But even there were very few symptoms, pathological symptoms, which was and also the exact characteristic symptom of burning. Burning was like a fire. So even if you have a very limited set of symptoms, and if you are able to choose a characteristic symptom out of it, you can arrive at a remedy. Now creosote, it was actually it was a very good learning for me in this case. Actually, I learned about creosote after seeing this case. Otherwise, I always would have prescribed creosote only for female problems. Now we know acridity is one of the symptoms of creosote, but commonly used in leukorrhea. It is lesser thought in cancerous conditions. Now in other materia medicas like boric and other places, we don't find this symptom under cancer stomach. But when you refer different books, like Pathak has given about cancerous affections, so it is very important to read different materia medica books, even if you when you get it through repertorial totality, you have to read from different materia medica books. It's very important, because I never knew that creosote can be thought in stomach cancers. Now unfortunately this patient is not there now. She expired few months ago, but at least I am happy that with the help of homeopathic medicines, as long as she was alive, she led a quality life. Like after creosote, her vomiting reduced, her burning also reduced. At least as long as she was alive, she was able to eat whatever she liked. So that way it helped her in palliation of her problem also. But finally she succumbed to CA. But my learning is like you should not fix yourself to any particular drug. Like now we have always read that creosotum is used either in dental problems or it is used in female problems, especially acridity of leukorrhea and things like that. But there is different aspect to every remedy. Only when you read that particular remedy from different materia medicas, only then you will understand the different scope of that remedy. Now case 4, this was a case of 7-year-old boy, ADHD, and the history was given by mother. He is having very low concentration and bedwetting. Bedwetting is there every day. During winter it is more. Now his concentration is very poor. This history was given by mother. His concentration is very poor. Even while watching cartoon, he keeps changing the channels. While writing spellings also, before he completes one word, he wants to write another word. Even while playing, he cannot play same game for more than 10 minutes. When questioned, first he screams and then answers. It's like in the clinic also, he was not sitting in one place, continuously running here and there, very, very hyperactive child. When I asked his name, he just shouted, screamed, and then only he answered. Like whatever I asked him, which school are you studying, he would scream and then answer. When I asked him about his name, he would scream and answer. If I asked about his parents' name, he would scream and then answer. So that tendency was there. And mother also told that he is very restless and always wants some activity activity at home, and when there is no activity he would just eat all the time, and it is mostly junk food. And sometimes the appetite is so much that he needs food every hour, and most of the time it is junk only. He never eats the other food like rice or dal and vegetables and other things. He doesn't eat. Always he prefers junk food. He has one more strange behavior. Like parents are also confused why he does that, because somewhere like when everybody are sitting, like even if the guests are there, he would suddenly run and come to the hall, remove his pants and stand. And when he is questioned why he is doing that, he would run away. So irrespective of whether there are other strangers present, guests present at home, or he is not bothered about it. He does that, and they are really not able to understand why he does that, because he is already 7-year-old, and they are also confused why he is doing it. And they said he is on multivitamin syrup. Again, this is a very long case, but I have chosen very few symptoms, and also I want to share with you the importance of repertorization here. So I have selected only few symptoms. And my observations were like the boy looked very thin, underdeveloped for his age. Like he is a 7-year-old boy, but he looked like somewhere around 5-year-old boy. Very thin, short, and very puny kind of a boy. And one strange symptom he had, parents did not tell, but it was my observation that he had a habit of biting his fingers. Like when he was running about in the clinic here and there, when parents asked him to sit quietly, immediately he would start biting his fingers. He would put his fingers into his mouth and he would bite it. So these were my observations. Now, rubric selected were here. Particularly, I have selected two repertories here. I chose complete repertory and Murphy's repertory, and as you can see, the rubrics selected are mind, concentration difficult, generalities, development arrested, nutritional causes from. Because in the history, mother told me that one thing is that they could find multivitamin deficiency, especially B12 deficiency, so he was put on multivitamin syrup. And not only that, somewhere his hemoglobin iron deficiency anemia he had about 2 years back, and he had to give iron syrup, and doctor also had advised, pediatrician had advised them to put him, even make dietary changes so that they give him a lot of iron to him. So I could find a lot of nutritional disturbances. Like in his the development arrested was not because there was no milestone delay, or the mental development was normal. There was no delay in the milestones or physical development as such. It looked more like a nutritional problem. So I choose to take development arrested, nutritional causes from. Then generalities, dwarfishness, because dwarfishness I have taken because it was my observation. He looked very short for his age. Mind, biting fingers. Mind, activity, hyperactive. Mind, shrieking, screaming and shouting. It was very unique in him, characteristic. And I have taken mind, shameless children, because he had a symptom of removing his pants. Now almost the same rubrics I have selected in Murphy repertory also. Now I want to make a note here. Now see, when this same set of rubrics were repertorized from complete repertory, the first choice of repertory was tuberculinum. Now when I repertorized this from Murphy's repertory, the first choice was medorinum. Now what to prescribe, whether medorinum or tuberculinum? It was very difficult for me. Now both are nosodes, and both are coming up in repertorial totality. It was very confusing for me, and this is when I chose to again take the help of Materiamedica books. I read different books, especially on homeopathic constitutions by Paul Herskeu and other books, and finally I was able to arrive at medorinum, and medorinum actually helped this case. He is still hyperactive, but his hyperactivity is better now. But here what I need to make a note is like whichever repertory you select, it is always important to read all the drugs, at least which come in the first 4 or 5 choices. You have to read and do a comparative study of those materia medicas. It's very, very important, because otherwise you can easily miss. Now in this case, tuberculinum and Materiamedica are so close to each other. Like tuberculinum also we can find hyperactive children, hyperactivity and development is arrested, even they look very puny and all those things. It is a very good remedy for attention deficit hyperactive disorders, all those things. Even Materiamedica covers all those things, and since both are nosodes, most of the characteristics will be normal. Now only after careful understanding and reading about Materiamedica, I could find that I could sense that in Materiamedica the important characteristic is the energy levels. Now we don't see that kind of an energy level in tuberculinum. Tuberculinum also are very hyperactive people. Materiamedica is also hyperactive, but when you grade that, in Materiamedica children are very, very energetic. The energy levels are throughout their throughout. But in tuberculinum sometimes there is also a phase of fatigue, especially in acute phases. Now they are very, very hyperactive, but when they have any acute symptom like common cold or whatever, the energy levels goes down and they have lot of fatigue. Now this I could not get in Materiamedica. Materiamedica energy levels are maintained through and through. This not only this, there are other few subtle differentiations between Materiamedica and tuberculinum. Now the point is, forget about what was prescribed in the case. Now when this kind of a choice comes up, you will always have a question. I always had a question. Now which to prescribe? Now do I prescribe tuberculinum or do I prescribe Materiamedica? Now if I prescribe one remedy, may it be tuberculinum or Materiamedica, do I need to wait? Or if I need to wait, how long do I wait? These are the common questions which came to my mind. Like now in case I give a particular remedy, say Materiamedica or tuberculinum, how long should I wait? And after waiting, if there is no progress, do I change the remedy or do I just change the potency? How do I assess that? What do I expect in the follow-ups? These were the common questions which popped up, and this is when the knowledge of organon helped me a lot. So this is what I actually, more than repertorization, particularly in this case, more than repertorization and selection of repertory, I would emphasize on knowledge of organon, because without the knowledge of organon, it was very difficult for me to choose the remedy in this case. Because what happens is, after waiting for certain period of time, you tend to change the remedy most of the time, and you will never go back to the remedy, and the case can be an utter failure. So if you have a complete knowledge of organon, then you will be it will be easier for you to decide on posology, and also it will help you or guide you to actually wait for the further course of action, and it will also guide you as to how long you have to wait and how you are going to do a follow-up in any case. So it is very, very important. It is just after repertorization, you cannot straight away just prescribe, just because in one repertory one particular remedy is throwing up. You cannot just throw up when there are two closer remedies, very, very closer remedies. Now when particular rubric is given under a certain repertory or certain drug, it definitely carries certain weight. Now in this, if you see calcarea, medorinum, tuberculinum, calcarea, zinc, everything, now it is given in that under particular rubric, means certainly it carries certain weightage. So you should always know how you are going to differentiate with each remedies, and especially when there are two similar remedies. This was a main purpose for me to select this case, because here in both the repertories, as I told, both we are getting nosodes, and nosodes there, and tuberculinum and Materiamedica are very, very, very close. It was very difficult for me to choose the remedy in this case, but as I told you, the knowledge of organon really helped me in this case. So this is what I need to convey, is I want to emphasize on your knowledge of organon in this particular case. Now I have few suggestions for you. Now, I improved my repertory skills through group studies. I strongly recommend that you people make a small group of say around 4 or 5 people. You select a particular repertory and a particular chapter. Each one of you select different repertories, and each one of you select the same chapter from different repertories, and list down few symptoms or few rubrics and similar rubrics, and try to read what are the drugs given under that, and why at all that particular rubric is given in that particular remedy. What is the meaning when that particular rubric is? What is the meaning of the rubric? And even comparative study of the drugs given under that particular rubric, and sit at least once in 15 days, read up in those 15 days, and after 15 days you discuss about whatever you have read. And I feel this is the best method to remember Materiamedica and repertory. And this way I have followed in my initial stages, phases. I have done that. Even today we do it. A group of our friends, we do it. And one more recommendation is study the selected remedy from all the Materiamedica books. Don't stick to one particular book. Just even if you feel that whatever remedy you have selected is exactly matching the particular Materiamedica book you have taken, you please cross-refer in all the available Materiamedica books. That's how you are going to read different shades of a particular remedy. This has helped me a lot. Somewhere, even at that particular point of time, even if your patient has not come up with those symptoms, it is definitely going to help you in other cases, because this type of study helps you to retain whatever you have studied, retain in your mind of whatever you have studied for a longer period of time. And even you have to compare whenever you have formed a repertorial totality. Always, like when you form a repertorial totality from one repertory, always cross-refer with other repertories. It's not necessary that you repertorize from all the repertories you have. At least cross-check and find out under that particular rubric under that particular rubric how it is presented in different repertories, and how you can compare in different repertories. So this also helps, because sometimes it might not help at that particular point of time, but somewhere it will flash your mind when some other patient comes to you, and you will be able to relate it to it very easier. You will suddenly it flashes to your mind that somewhere you have read that, and it will be easier for you to locate in that particular repertory. And never ever adhere to one particular method. There is no particular method or no particular repertory or no particular Materiamedica you should stick on to. Everything is a treasure by its own, and everything has to be read. And last but not the least, be a learner forever. Every day you have to make up in your mind that you are going to learn something new on that day. Even today I have made this practice, like whenever I get a free time, I just pick up some repertory, some random rubric, and I try to see which of the drugs given under that. At least try to read one remedy whenever you have a free time, and and you will know different aspects or different shades of that particular remedy. Definitely it is going to help you in future. Thank you for listening to me. Please do share your suggestions and thoughts. Once again, welcome you all. Please let us all learn from each other. Thank you.